Assalamualaikum and hi. I am Teacher Aisyah. So today I will be presenting my very first topic, which is seizure disorders and epilepsy. Okay, firstly, let's go through in depth what is epilepsy disorders and seizure. So epilepsy disorders is a brain condition that causes seizures. Use epilepsy terms used to describe seizures that occur repeatedly over time without an acute illness like fever or an acute brain injury. And seizure is a temporary involuntary change of consciousness, behavior, motor activity, sensation, or automatic functioning. Cause can be provoked. There are two causes that can cause seizure, which is can be provoked or can be unprovoked. It can be provoked is such as fever in young child, while cause can be unprovoked such as can related to genetics or brain injury. Okay, so our brain is made up of billion nerve cells called neurons, which communicate with one another through tiny electrical impulse. So a seizure occurs when a large number of these cells send out an electrical charge at the same time. This abnormal and intense wave of electricity overwhelms the brain and results in a seizure, which can cause muscle spasm, loss of consciousness, strange behavior, or other symptoms. And when a child has two or more unprovoked seizures, epilepsy is often diagnosed. There are two types of seizures, which is partial seizures and generalized seizures. Partial seizures is an abnormal electrical discharge in one region of the brain, while generalized seizures is a widespread excessive electrical discharge that involves both hemispheres or sides of the brain at the same time. One of the symptoms for partial seizures is change in behavior, thinking, or movement, and can spread to the other side of the brain, causing a tonic-clonic seizure, which is a generalized seizure that leads to a loss of consciousness. Okay. For generalized seizures, there are a few symptoms such as blinking and staring, loss of muscle tone, stiffening of limbs, and when the entire brain is involved, rhythmic and full body jerking. Okay, there are a few types of partial seizures, which is simple partial seizures and complex partial seizures. Okay, simple partial seizures is usually involve motor cortex. Simple partial seizures can affect a single part of the brain, causing small and subtle change in consciousness, such as twitching or unusual perceptions. Can involve too jerking of one or more parts of the body or sensory change like smells or tingling feelings that may not be obvious to onlookers. Okay, usually, the children won't lose consciousness and may also have sweating, nausea, or become pale. Okay, during the seizure, the person is fully aware of what is going on, while complex partial seizure often occurs in the area of the brain that controls emotion and memory function, which is temporal lobe, will likely lose consciousness. This may not mean the children will pass out. The children may just stop being aware of what's going on around him or her. May look awake but have an unusual behavior such as gagging, lip smacking, running, screaming, crying, or laughing. The person is unaware of what is going on around them and may be unable to talk normally. And this type of seizures typically lasts 1 to 2 minutes. Okay, other type of seizures is infantile spasm, which is a specific types of spasms and seizures in children younger than 2 years old, which is typically begin from 6 months and disappear by 24 months. Lasting just 1 to 3 seconds and cause stiffen or jerk their arms and legs every few seconds for 5 to 10 minutes. Okay, this type of seizure is very brief, which is just a few minutes for 5 to 10 minutes. During this time, development appears to stop and skills may be lost. Okay, there are a few types of generalized seizures. One of it is tonic-clonic seizures, which is uh, known as grand mal seizures. A person that have this kind of seizures may have an aura or sensation that the seizure is about to begin. An abrupt loss of consciousness and body stiffening, twitching and shaking, sometimes loss of bladder control or biting of the tongue, may last 5 minutes and followed by a post-ictal period that may last 1 to 2 hours during the child is drowsy and or in a deep sleep. Okay, this kind of seizures is these non-specific seizures can occur at any age and involve excessive neuronal firing from both hemispheres in a symmetric pattern. Okay. One of the generalized seizures too is absence seizures, as known as petit mal seizure, which is a brief change state of consciousness and staring, will likely maintain posture, mouth or face, and may twitch on eyes or eyes may blink rapidly. Usually lasts no longer than 30 seconds and may occur several times a day. Almost always start between age 4 to 12. Okay, this kind of seizures is an abrupt interruption of an activity. A glazed look, stares, and unawareness of surroundings characterize a child having this kind of seizure. This may be mistaken for daydreaming. When the seizure is over, your child may not recall what just occurred. He or she may go on with activities as though nothing happened. This kind of seizure is really uncommon among child and adolescent but still can happen. Okay. Lastly, a child who has a seizure must undergo a true evaluation to determine the factors that cause it. A family history, medical history, and developmental history must be completed as well as an electroencephalogram (EEG) to help determine the types of seizure. Okay, so how are seizures usually treated in a child? Okay, usually anticonvulsive medication is given to the child. Anticonvulsive medication are administered in an attempt to control seizures. In theory, this kind medication increase the intensity required to trigger the seizure or eliminate the recruitment of surrounding cells. Some of the common side effects such as including weight gain, drowsiness, high blood pressure and others. Okay, the type of medicine will be given is depend on the type of seizures, age and health and possible side effects. The most commonly used medication are benzodiazepines to get into the blood because it get into the bloodstream quickly to start working on the brain to stop the seizure. The amount of medication prescribed may be adjusted up or down based upon seizure control and or side effects. Main people with seizures, the children with seizures may not need medicine for life. Medicine will be taken off if had no seizure for 1 to 2 years. So after the children taking the medicine, there are tests. There are tests that needed to see how well the medicine is working, which is the children may have uh, do test, which is to check the level of medicine in body. Based on this level, the healthcare provider may change the dosage or the dose of medicines. May also have blood tests to check the effects of the medicine on his or her other organs. One of it is urine test will be test to see if the medicine is working or not, which is tested to see how body is reacting to the medicine. And the other one is electroencephalogram EEG, which is a procedure that records the brain's electrical activity. This is done by attaching electrodes to the scalp. And this test is done to see how medicine is helping the electrical problems in brain. Okay, so if medications are not effective, there are a few other treatments will be used to control the children's seizures. Which is one of it is ketogenic diet, which is consists of a carefully monitored intake of fats, sugars, and carbohydrates that force the body to use fat rather than carbohydrates for energy and alters neurotransmitters. Okay, the second one is vagus nerve stimulation (VNS). Okay, this treatment sends small pulse of energy to the brain from one of the vagus nerve. This is a pair of large nerves in the neck. If your child is age 12 or older and has partial seizures that are not controlled well with medicine, VNS may be an option. Okay, and the last one is surgery. Okay, surgery may have been shown to be effective by reducing the seizure focus of the brain, particularly in complex partial seizures arising from the mesial temporal lobe. Okay, surgery may be done to remove the part of the brain where the seizures are occurring, or the surgery helps to stop the spread of the bad electrical currents through the brain. And surgery may be an option if your child's seizures are hard to control and always start in one part of the brain that doesn't affect speech, memory, or vision. Okay, lastly, there is an effort that the parents can do for their children that having epilepsy disorders and seizures at home that can be a self-care at home. Okay, one of it is help the child to lie down on their side, preferably in a flat, non-crowded area. This will help prevent the child from inhaling any possibly vomit, which can lead to aspiration pneumonia. Okay. Immediately check to see if the child is breathing and continue observing the child for breathing both during and after the seizure. And if your child is not breathing within 1 minute after the seizure stops, start mouth-to-mouth rescue breathing or known as CPR. Okay. After the seizure ends, place the child on one side and stay with the child until they are fully awake. Do not try to give food, liquid, or medications by mouth to a child who has just had a seizure, unless the child is fully awake and alert. There is a danger of the child inhaling any food, medication, or liquid. Okay, so the children with known epilepsy or a history of seizures should also be prevented from further injury by moving away solid objects in the area of the child. Talk to your doctor about a seizure action plan that has rescue medications. If you have discussed the use of rectal medication with your child's doctor, give the child the correct dose as directed if the seizure lasts more than 5 minutes. Okay, so that's all from me. Okay, thank you for listening.